Hi, my name is Ryan Schaefer and I'm a firefighter and EMT with the Kirkland Fire Department.
And my name is Skip Boylan and I'm with Redmond Medic 1.
We are here to talk to you about the new King County COVID-19 Best Practice Scout Model Guideline.
The great thing about the Scout Model Guideline is it really doesn't change very much what we do in King County. We have a tiered response system where dispatchers ask specific questions and send appropriate resources. Then EMTs make the determination of sick versus not sick, or advanced life support versus basic life support. So the idea behind this whole concept is to reduce the amount of people that could potentially get exposed to COVID-19.
We're going to go through what a BLS scenario would look like. While responding to the call, it is our hope that dispatch will gather as much information as possible so we know beforehand if this patient is a high-risk COVID-19 patient, and we would also like dispatch to relay to the patient to meet the crew at the door if and when possible. Upon arriving at the scene, the EMS crew is going to designate one member as a scout, and that scout is going to be in full MAG PPE. That means N95 mask, iPro, gown, and gloves. If your department has different COVID-19 PPE protocols, then go with what your department recommends. The scout will also carry with them a quick jump kit, which is just a bare bones medical kit to get a quick set of vitals, as well as having some additional PPE and masks to give to the patient. It's important to recognize that that jump kit should be in a hard shell case for easy decon purposes after the call. Once patient contact is made, the two remaining crew members will still be there on the scene, but far enough away to be outside the hot zone, while still close enough to be in the line of sight for situational awareness and also close enough for verbal communication. The scout should have two objectives right out of the gate. One is getting a surgical mask on the patient, and the other is to determine if this is a high risk or low risk for COVID-19. Some questions the scout can ask are, has this patient tested positive for COVID-19? Has this patient been in close proximity to an individual that has tested positive for COVID-19? Has the patient recently visited a skilled nursing facility? And is the patient displaying any symptoms and signs that we typically associate with COVID-19, such as a fever, a cough, or any respiratory difficulty? If the scout determines that this patient is low risk for COVID-19, they will notify their crew members and they can all go in and proceed with routine patient care. If it's determined that this patient is high risk for COVID-19, then we want only the scout to maintain that patient evaluation, again, with the remaining crew members in close enough proximity to still be there to help out, but outside of the hot zone. If it is determined that we are going to transport the patient, the scout will notify their crew members and allocate resources as necessary. It is important to note that if we are going to transport, we would like at least one crew member that has not been in the hot zone to drive the transportation vehicle. If it is determined that we can leave the patient at home, however they are at high risk for COVID-19, we can leave the patient with a pamphlet that instructs them on what to do and how to maintain self-care while being at high risk with COVID-19. Remember, the goal in mind here is still to provide excellent patient care while also reducing the number of personnel that we are putting in harm's way. Now let's see what a BLS scenario would look like with this new scout protocol. You see the EMS crew has arrived on scene. The scout EMT is meeting the patient. They have with them the quick jump kit as well as a folding chair. That's if the patient is able to meet the scout at the door. It gives the patient somewhere to sit. It's also easy to decon. The EMT hands the patient a surgical mask and is also going to get a quick set of vitals and ask some questions. Again, these questions are to determine whether or not the patient is at risk of COVID-19. They should consist of whether or not the patient has had a confirmed positive test of COVID-19, if they've had known contact with a COVID-19 positive person, if they have recently visited a skilled nursing facility, or if they are displaying any symptoms related to COVID-19, such as fever, cough, or respiratory difficulty. Okay, after those questions, the EMT can gain an initial set of vitals. I've already got the O2 sat monitor on. Now going to be taking a temperature. Okay, you'll notice that the other two crew members, while not in the hot zone, they are still maintaining situational awareness, and they're in the line of sight with the scout, and they can also be in verbal communication. You'll also notice that the officer has the tab outside of the hot zone in the cold zone. The scout can gather any kind of pertinent information that they need. They can write it down on a whiteboard that is in the jump kit, patient's vitals, as well as any kind of personal information, date of birth, name, what have you, and that can be relayed to the officer at a later time. Okay, so now the EMT is determining if this patient is negative risk or positive risk for COVID-19. It looks as though the patient is positive risk. They have handed the patient a pamphlet, which will give some self-care instructions on what to do if we determine we can leave this patient at home. If it is still necessary to transport the patient, we have our 2 remaining crew members that we can utilize as a resource to do so.